Hi everyone, I'm here with Dr. Leah Foster. Leah, great to see you.
Nice to meet
Thanks
you.
so much for being here with us today. And Dr. Foster, Dr. Leah Foster has just moved here from Oklahoma. Dr. Holloway Chiropractic is right here close to us, and they do a fantastic job. Dr. Holloway has been doing it for 40 years, and it's just tremendous there. A lot of people know it as Van Hool Chiropractic. But Dr. Leah, I tell you, a great pleasure. I actually got the opportunity to see you yesterday working, and you were fantastically knowledgeable. But tell us about, you're just moving here from Oklahoma. You and your husband moved here, and just in the last few days.
Yeah.
And so how do you like it here?
Oh, it's beautiful. We've, stepping out of the car, and we come from Dallas just recently, and it's 110 degrees, and you step out, and it's like, oh my gosh, I can breathe again.
Yeah.
So it's just beautiful, and we've really enjoyed it.
And I tell you what, a lot of people don't realize, but nowadays, a doctor of chiropractic medicine is, the number of years you have to go to school and everything. Tell us about, you went to Oklahoma Panhandle State University, then you went to Parker University in Dallas, but tell us all about, the number of years and everything that you've been studying.
Okay, so I had 4 years of undergraduate to get my bachelor's of science, and then 4 years at Parker University. They give you 3.5 years of just academics, like in the books, medicine, what you need to know, and then just a whole year of dealing with patients. So basically seeing people, treating people, making people well.
Yeah.
It's really great.
That is neat. So you came from Guyman, Oklahoma, if anybody knows where that is, in the Panhandle part of Oklahoma?
That's right, yeah.
Yeah. And tell us about your background with your parents and everything, because that's very interesting too, in terms of they're both professionals and very kind of helped. Your dad being a dentist probably got you into the medical field to some degree.
Right, yeah. My dad is a dentist. My grandfather's also a dentist, actually, so I kind of grew up in a very medically minded, health-oriented household. My mother is a counselor, and she actually was a principal for a couple of years, but then she kind of switched courses to become a counselor, and she's doing very well with that. They're divorced now, but my father lives in Winston-Salem and was actually the first person to kind of bring me around to Boone and say, hey, look at this beautiful place, you should come visit. And I thought, man, I'd really love to live here, and now I'm so lucky that I get to. So.
Yeah, I'm sure he was really happy when you decided to come back over this way.
He's been excited.
Yeah. So tell us then, your background also, you did a lot of plays and musicals and growing up in high school and in college, and tell us about some of that background and the debate.
So in Oklahoma we have a program called Drama Debate, where you do one or the other. It's not a both thing. God, that would be so busy. But basically it's like one-man plays, and you take a script, you memorize it, and then you have different characters that talk to each other. And so it's a lot of fun. I did that for 4 years in high school, had a lot of success with it, had a lot of fun, and then did several plays in our community theater that we have there. Most recently, Sweeney Todd and Seussical.
Yeah, so you finished, fourth in the state of Oklahoma for two different times, two different years.
Yeah, junior and senior year of high school, I was fourth in Oklahoma. So
yeah, that's tremendous.
Thank you.
So what made you really want? Okay, you get into chiropractic. Obviously, at the beginning, when you first were going to medical field, you weren't sure which avenue you were going to take. But tell us, what really drew you to chiropractic medicine?
Well, the thing is, I was thinking I would like to be an optometrist because I used to work for an optometrist, and they made a very good living, helped a lot of people, and I thought that's really cool. But then as I started to study optometry, I thought, man, it's so specified, just this one area of the body to understand and really know about, and I want more, I want to know more. So I was kind of lost there for a little while, not sure what I wanted to do, and then I got into a car wreck and started going to see a chiropractor. I noticed that a lot of the complaints that I had that really had nothing to do with my spine started to feel better and started to make me just feel more well, and so I looked into it and I thought, man, I could get behind this.
Yeah, so. That was amazing. I actually started going to them back in the 80s when I was playing football, and back in those days they weren't as well known as they are nowadays. But now if you look at professional sports teams, they all, they're getting treatment all the time and everything, and it's amazing what he can do. I've had injuries where, say, a shoulder injury where I couldn't even lift my arm, and I lived with it for 3 or 4 or 5 months like that, and then went to a chiropractor, and And immediately he just did that and said, "Why didn't you come sooner?" And I said, "Well, I didn't know you did shoulders." You know, because you always think of a chiropractor just doing backs, but it's amazing that you can do anything, can't you?
Oh yeah, any joint in the body can be adjusted. Any joint that isn't moving probably ought to be.
Yeah.
So, you know, it's something that a lot of people just don't realize that needs done, but can really be beneficial.
Yeah, and what I saw yesterday when I saw you in action, but in working, but it goes all the way through the body, doesn't it? So if there's something wrong in one spot, it'll actually have a knock-on effect, you know, to different parts of the body.
Absolutely. You know, as you saw yesterday, you know, with the foot translating up to the knee, and what people don't realize is the body tries to compensate a lot. So, you know, if you have a problem with this knee, you know, sooner or later your other knee is going to have problems because you're putting more weight on this leg or trying to favor it. The body does its best to serve you, but sometimes it just needs a little help.
What I was amazed by yesterday in talking to you was whatever question came up, you know, the knowledge you have of the body, you know, of all the parts of the body is amazing. You talked about how, just a minute ago, about, you know, the eyes were very limited in terms of the, you know, it was just one part of the body. But a chiropractor has to know all parts.
Right.
You know.
We do in Parker, we're fortunate enough to have a gross anatomy lab where we actually see the cadavers, and we get to actually see, and we have to memorize every muscle of the body, what nerve goes to it, what does it do, how does it work, when it gets injured, what's the most likely thing that's going to happen. And I was just very blessed in my education to be able to know all of that, and to you know, really get a hold on it.
So tell us a range of things. I mean, obviously a person with any kind of difficulty could potentially come to you, but if you would, give us a range of things you've seen in your time where somebody got better from chiropractic.
Okay, so let's see. Alphabetically, let's say asthma.
Yeah.
Asthma and allergies is the body over-responding to pollen or dust or something that's really non-toxic in the air, but your body doesn't know what it is, and so it kind of freaks out a little bit.
Yeah.
And when you get that connection with your nervous system going through your entire body without the interference of a locked up joint, it just really opens up a whole new world of health, because your body's like, oh, I don't need to wig out over that. That's just dust, you know. And I've been fortunate enough to see so many people, knee injuries, shoulder injuries. I actually had the unfortunate experience to find a patient who had cancer, and actually got to see that on x-ray when we took the films and sent him on his, you know, way to recovery with someone else, because, you know, we still love to see patients with cancer. We love to help them with their pain, and we love to help them, you know, with their recovery, but obviously there's other things that need done as well, so we sent him to an oncologist. That's probably the most extreme thing I've seen. We've also, you know, any joint, like I said, any joint of the body. Yeah.
Well, what I've found is amazing, and so many people look at, you know, medical doctors and everything, but I've found that a lot of times if you go with, for instance, if I'd have gone with my shoulder to a medical doctor, they would have probably had me in line for maybe even potentially surgery or something that, and so they look at things in a totally different way than you do, whereas you can look at a way to solve it. They would look at a way, it's almost, a lot of times you hear complaints with regular medicine that they just try to fix it after it's broken, but they don't really do anything, you know, something that can help it. So
we like to say that DC, which is Doctor of Chiropractic, actually stands for Doctor of Cause. So we look for the cause of why your shoulder's hurting. Do you sleep on it weird? Did you do this one traumatic motion one time that knocked it out of alignment? We like to look for, it's more of a vitalistic approach, I suppose. We like to look for, why is this wrong? Let's fix the behavior. Let's fix the, you know, the trauma that actually happened, and then let the body do its business, because you don't need to go to see a doctor when you skin your knee. Your body just heals itself, and so you remove the interference with chiropractic, you move the interference with nutrition, and suddenly, you know, your body heals itself just like it knows how to do.
Yeah. Tell me about it. I'm just interested myself. I remember one time, you know, in football, sometimes you might get hit and kind of knock your, you know, maybe your jaw just a little bit. But, and you guys can fix that too. But tell us about things like that, where, because there's a lot of nerves and everything that say run down through that area.
Right. So let's say, you know, you get hitting the jaw, going this way, and it like that. That's going to put a stretch on all of the ligaments, all of the muscles that run through here. Now, each of these ligaments and muscles is innervated by different branches of your nerves. And so what we would want to do is first off put it back into place if it's stuck out of place. So we'll do that. And then you have to sometimes work the muscles in order to get those nerves to calm down, because they've been constantly firing, saying, hey, we're stretched, hey, this isn't good, you know, for as long as it's been since you've been doing that.
Yeah.
And it's basically, you know, you just have to tell them, we see you, we acknowledge you, now calm down.
Yeah.
And so then it starts to heal itself.
And tell us about, like what I saw yesterday, you were working with a hip sort of, or the pelvis being out of alignment. Mm-hmm. Tell us about how that works, and then carry it on down through the knee and to the ankle, and what effect that pelvis might
Okay, so the pelvis that he's referring to yesterday was twisted just a little bit. It's, you know, as you walk, your body is designed to kind of move in this sort of way. I'm not sure if I've got the camera. There we go. So as it gets stuck in one way or the other side has to move more. And so you want to make sure that both sides are moving equally and that both sides are moving well. Well, let's say that one of them's stuck in a backwards position and this other one's moving too much. Well, now you got irritation on the one side and stagnation on the other. So what we like to do is we like to adjust or block. Different chiropractors address this in different ways. Some of them will give you the old crack, and Dr. Holloway and I actually like to use blocks, which is a little bit gentler and just uses gravity to help slowly work that joint back into alignment. But as you've got one that's moving too much, that's putting additional strain on that knee joint, which in turn, you know, has to be balanced by the ankle, which has to be, you know, pushed off from the toes, so you get the toes to kind of jam. And you know, likewise sends a similar effect up your spine. So, you know, one side's not moving, so your back has to compensate this way, and then back a little bit this way to keep your head level, which is what it wants to do all the time. And it's just an amazingly complicated, beautiful machine that always wants to serve you and, you know, just tries its best. Yeah. So.
It's amazing. I wanted to ask you that question because I'm amazed when I listen to her talk, because you're so knowledgeable. You know, I've been around a lot of chiropractors, but you really are the most, you know, extremely knowledgeable.
Thank you.
Now, Dr. Holloway is a fantastic man. I mean, he's got so much personality, so much charisma. So you enjoying being with him?
Oh yeah, he's terrific. I actually, when he first called me on the phone, I was like, who is this guy? You know, like nobody's this happy all the time, right? Yeah. So then we met him. I'm like, man, this guy is probably one of the most genuine people I've ever met, and just really fantastic to work with. He's very knowledgeable, and he's you know, just really great. I'm so looking forward to working with him a little bit more.
Yeah, I've seen him do things too. I've watched him correct people, and he's done a fantastic job, and he's been doing it 40 years, and he's really knowledgeable. So I loved it yesterday when I was in there with both you and he, and I could listen to both of you talking, because it was like I was just constantly learning things.
Yeah, he's terrific.
Yeah. So tell us about now. So you're up here in Boone. It's Greenway Business Park. Here on Greenway Road, which is the back road, sort of behind the Boone Mall, on the back way into Walmart there. Right. And so you're going to be here. You're here Tuesday and Thursdays in the mornings. Right. What, 7 to 12?
7 to 12. I hope to be here at 7. That's really early for me. Definitely 8 to 12 for me. So.
And then you're also in Wilkesboro. Monday, Wednesday, and Friday, the same hours. Same hours down there. So anybody that would like to go to the Wilkesboro office, or to the Boone office, you could, you know, one day, any day of the week, you could accommodate them at one of those places.
Right. That'll be for about the first month. Starting in September, I hope to be able to expand the hours so that I'll be there from 9 to 5, 4 days a week from Monday through Thursday. Yeah. So, and I'll be in the Boone practice, so that's kind of what I'm hoping. That's the timeline I'm shooting for, so we'll see.
Yeah, so you'll be focused on the Boone practice, and Dr. Holloway then will be focused more on the Wilkesboro practice.
Right, right. That's his first love, is the Wilkesboro practice. He loves the people down there, and I can't blame him. Yeah. You know, so many nice people in North Carolina. I'm like, why didn't I come here sooner?
Yeah. So you and your husband enjoying being here?
Oh, it's been terrific.
Yeah,
it's been great. Everybody I've met and I say, oh, I've just moved here, they say, oh, well, welcome, you know, so
yeah,
nice.
That's great. And so I'm sure you're really going to love it because the people here are wonderful people to be around.
Yeah, they're fantastic.
But I think that you're going to contribute a lot to our community, and it's going to be great everything that you do. It'll eventually be 9 to 5, 4 days a week, and then Monday through Thursday?
Yeah.
Yeah, Monday through Thursday. But now, if you want to give Dr. Leah Foster, Dr. Holloway, a call there, if you'll be in the mornings, 7 to 12 potentially, 8 to 12 maybe if you see with Dr. Leah, and then that'll be Tuesday and Thursday in Boone, Monday, Wednesday, and Friday down in Wilkesboro. So just fantastic, and I urge you to do it because I've never met, and I've been around a lot of chiropractors, but I've not met anyone that has the knowledge that both Dr. Leah and Dr. Holloway have. It's fantastic, and they can really help you. And it's great to have you here in our community, but not a whole lot of people move here from Oklahoma, I don't think. You know, I mean, you talk about people moving from Florida, moving from New York, but Oklahoma is a little bit more unique in terms of somebody choosing to come across in our direction.
Yeah, I think a lot of people in Oklahoma have never been here. So if they want to live in the mountains, they go to Colorado because it's, you know, they know Colorado. People usually don't travel someplace they've never been and just say, oh, I want to move here. So I'm fortunate that my dad moved out to Winston-Salem so I could come and see and know how wonderful it is. So.
Yeah. But I tell you what, it's been great to have you on here.
Thank you so much.
And thank you so much for everything I've learned, even just being around you for a couple days. And you do a fantastic job, and also Dr. Holloway. So give them a call. But it's really nice to have you here in our community.
Well, thank you. I appreciate it.
Thanks, Leah. Take care.